This is the ASMR Medic. I hope you're well. As you can see in front of me, probably by the title of the video, we're going to be doing another Let's Learn Human Anatomy video. I've got my favourite human anatomy book in front of me, the Atlas of Human Anatomy by Frank H. Netter. So, what I wanted to kind of bring you guys along with me for was just a kind of standard, I guess, top up or kind of recall revision session that I do maybe once every couple of weeks or whatever. Not too often, because it's not exactly strictly directed and revision. I'll kind of pick a topic, find it in this book, and I'll just flick my way through, look at the different anatomical structures, different terminologies, and I'll just see if I kind of recall what they are and if I can remember some different facts about it, and kind of describe it with at least a reasonable amount of detail. And if I can't, maybe I'll look over it. Gives me an idea of where I am. Gives me a sense of if I know things in a broader sense, rather than just sort of the bare minimum. And it's quite relaxing, I think. I can't do this thing when I'm wanting to revise, but not really use my brain too much. So, I wanted to go over the lower limb. We did the knee, which is a section within the lower limb, as you can probably expect. So we might skip over that. But I really don't know how far we'll get in this video. Just wanted to kind of introduce you to my favourite anatomy book. Maybe introduce you to some new terms, some new kind of structures that you might not be aware of. Give you a kind of a broader idea about anatomy and what it really means. This is a good idea to do, I think, if you're a medical student. If you do dissection at your university, like I do, you'll probably be familiar with the concept of sort of verbal recall that they make you do. So we'll be standing around the dissection table, and our demonstrator will point to a random structure, and he'll ask us, what it is, or if he tells us what it is, he'll at least ask us to kind of describe it a bit. Yeah, you can kind of see how that might warrant a reasonable amount of revision before going in. So let's get into it, shall we? I think I'm actually going to have a cough drop before we get into it. Hope that wasn't too loud. I'll try to adjust it if it is. So, as in most sections that regard a particular part of the body, such as the lower limbs, the upper limbs, the trunk of the body, the head, the best place to start usually is the surface anatomy. I'll give you a quick closer look at this image. Kind of familiarise yourself with it. right at the top, starting really at the very top of the hip, going down through the pelvic region, down through the thigh, past the knee, through the leg, which if you remember from, or if you watched the last video, the leg, this is really the only region that we call the leg. As I said, this is the thigh, this is the leg, not the lower leg and not the upper leg. The thigh, and the leg, and then of course we have our feet. It's right at the top, right on the edge of our pelvic bone, which is this large bone here, which I'm sure you're all familiar with to some degree. On the most lateral side, lateral of course meaning opposite to medial, everything on this side with relation to things on the inside are lateral. Lateral structures, medial structures. Of course things here can be medial in relation to things just here. And things here can be lateral in terms of things here that are medial. It's all in relation to things spatially. Pardon me, I'm just going to get a quick swig of water. So the most, well, as can be seen on this particular image, in terms of surface anatomy, the most superior, so the thing most towards the top, and the most lateral, the iliac crest. The iliac crest is quite a large structure. It extends from the very edge of the ilium, the ilium being one of the three pelvic bones that make up the pelvic bone. The ilium, the ilium, which is more inferior, and the pubis, which as you might be able to guess is more medial, but also more inferior in terms of compared to the iliac, to the ilium. Sorry. Follow this with the anterior, superior iliac spine. Now this is a very prominent and an anatomical structure that can definitely be felt on everyone. If you press the most lateral part of your pelvis, that bit that kind of juts out, the bit that you might whack on the side of a table every so often, very strong bony projection on either side of your pelvic bone. That's the anterior superior iliac spine, or the ASIS, as is commonly shortened to. We'll skip through some of these that I don't think are quite as interesting or important. Now, the anterior superior iliac spine, as you might be able to expect, is in reference to other iliac spines that are present, obviously within the pelvic region. So this iliac spine being, as you might be able to expect, some sort of spinous projection, quite pointy piece of bone. Iliac, as in, because it's of course related to the ilium bone of the pelvis. Anterior, because it's on the anterior, which is, as we know, the front. So this is an anterior view of the lower limb. You can see the knees at the front. The feet are pointing forward. And this is a posterior view. I remember that because obviously, at least in England, posterior is a kind of funny term for your bum. Your posterior. From the posterior view. As you can see, you've got your popliteal area here, which is what we refer to as the back of the knee. This is the popliteal fossa. Fossa being a kind of indentation, that's what it says there. Popliteal fossa. Kind of forms a diamond-shaped structure behind your knee. And if you feel it behind your knee, if you put your hand there now, you can feel there's a kind of a diamond-shaped hole, roughly, in the back of your leg, behind your knee. You can kind of, if you aren't too squeamish, you can really poke your finger quite deep into that area. And there are a lot of structures that doctors like to be able to find within that. It's very useful anatomical structure. A good reason to say why anatomy is a very important subject. And so if there's an anterior, superior, meaning high or top, towards the trunk, or towards the top of your body, more accurately, that means there is probably a spine that is posterior, and there is. It's not on this, it's not really a piece of surface anatomy because you can't feel it. And there is a anterior, inferior iliac spine. So one that is on the anterior, but inferior, and it's about here. Again, it's not marked on this surface anatomy, because you can't see it, you can't feel it really, unless you really dig your fingers in, which isn't particularly pleasant. The whole point of surface anatomy is that it's kind of readily felt on the surface, like your knee, or some of these muscles, your toes, of course these are all surface anatomy. So, as you can see, something like the anterior superior iliac spine sounds like a really complicated anatomical term, quite difficult to remember, but not really. All you need to remember is that there's a spinous projection just here, and then all I need to think is, well, I know that it's within the pelvic region, I know that it's quite laterals and superior in terms of the pelvic region, so it's probably going to be the ilium bone. So it's going to be an iliac spine, and I know that in relation to the other spines, there's three. One roughly here somewhere. There may even be four, I can't remember. Roughly here somewhere. And there's one here. It's going to be anterior. It's on the anterior. Superior. Iliac spine. Easy peasy. Moving swiftly on. Maybe not quite. We have a few muscles, the ones that make up the big chunky muscles in our thigh, and on the anterior aspect. Tensor fasciae latae. That really only shows up shows up to this degree if you're a real athlete, like someone like Cristiano Ronaldo. If he tensed his thigh, you probably would see the tensor fasciae latae. But most of us, you can feel it, but it certainly won't stick out to the degree that it does in this image. And sort of medial to it, running obliquely down the thigh, is the sartorius, and you can really get a sense of what these muscles do from where they attach and where you can see they kind of insert, so attaches, so originating sort of up here by the anterior superior iliac spine region. I'm not exactly sure where they attach. They might attach to the I think they probably attach to the greater trochanter of the femur, or possibly somewhere along the iliac crest. I don't know. If you are interested, please look it up. Don't take my word for it all. But you get an idea of what they do, because the sartorius muscle originates somewhere up here, So it goes over the hip muscle, over the hip joint, and muscles that cross over these joints are the joints that they act on. So it originates somewhere up here, comes all the way down, obliquely. Oblique meaning kind of at an angle like this, kind of running like that, rather than straight down, which would be a rectus muscle, or sometimes referred to as a rectus muscle, such as the rectus femoris. Rectus meaning straight down. So the sartorius muscle originates up here, inserts somewhere down here along the knee. It may even cross over the knee slightly, I can't remember again, I'm not sorry that I'm not so sure. And so when it contracts, so the muscle contracts and gets smaller, if this gets smaller, you can see that it will probably rotate the leg this way, or pull the leg up. So we'll call it lateral rotation of the leg. And that's what allows us to do that motion of moving our knee outwards, or our hip outwards. Rectus femoris here, originating up here, crossing down here, and inserting over the knee, or just on the knee. This is the rectus femoris tendon. Muscles always turn into tendons before they insert. It provides a more stable, stronger attachment site for muscles. So rectus, because it's straight down, rectus meaning straight, as I just said. Femoris, related to the femur. Femoris really means anything related to the leg, really, femoral, such as the femoral artery. But femoris, really, I remember is the femur, especially here, because it really is just the femur that's in this area here. And then you have your two of your vastus muscles, your vastus medialis, obviously in the medial aspect, the lateralis muscle on the lateral aspect, and you have your intermedialis, which should be somewhere in this side, I think. It may even be here. Of course it would be. It was between the lateralis and the medialis, so that makes sense. Vastus, medialis, intermedialis, and rectus femoris make up your quadriceps muscles. I remember in the last lecture. Actually, you know what? I'm not so sure about that now. It may be a different one. I'm still not sure. I didn't look it up. I apologise. But the vastus, the intermedialis, the medialis, and one other, which I think may be the rectus femoris, form the quadriceps femoris tendon. So it's 4 muscles that together form one tendon, which is why we know it as the quadriceps, which is 4 quad, ceps, heads. So femoris relates to the femur, and I talked about this briefly in the last video, because obviously it's all related to the knee. So we'll move on. The iliotibial tract is a piece of very thick fascia that comes from the fascia lata. Fascia lata being this thick amount of fascia, that thick fascia that coats your bum, the back of your leg, the front of your leg. Very thick, hard to break through, very strong, very stable. Becomes even thicker and even stronger on the lateral aspect, sort of the very lateral aspect of your thigh, going down, mainly more sort of inferior lateral aspect of your thigh, forms the iliotibial tract. And if you feel sort of right down that side that I'm talking about, sort of about here or here, you will feel that it is quite tough skin. It's not got as much pliance to it as other skin does. It's not a muscle. It's just it's called the iliotibial tract. Ilio. I think that's maybe why it's called this. Ilio, referring to the ilium. Tibial, relating to the tibia, which is the largest bone in the leg. And then we have your patella ligament, and the tibiotuberosity, which we covered in the last video. The anterior border of the tibia, also known as the shin, which you can feel all the way down the anterior medial aspect of your leg, from the very top of your knee right down to the bottom, and that is your tibia bone, or the anterior border of your tibia bone. The great saphenous vein, which again really only shows up if you're particularly, it comes all the way from down here, the great saphenous, all the way down here, passing through the popliteal fossa. Here, as you can see, great saphenous vein passes just medially to the popliteal fossa, and then down and wraps back round to the anterior aspect again. The knee is quite a difficult structure for vessels to navigate, and so they kind of always put. That's why the popliteal fossa exists, and it's quite so important. Blimey, we're already 20 minutes in. I think I may have to kind of get a move on. Perhaps we'll just cover the surface anatomy in this lecture. Who do I think I am? In this video. And then we can move on. Or perhaps in another video, or another lecture, shall I say, we can just kind of flick through quite quickly and see what the very basics of things are, rather than me just sort of dwelling so fervently on one thing. I made this video sort of as a page flipping idea that someone pointed out to me might be quite a good idea, and I've done no page flipping because I've managed to get through about 10 terms in about 20 minutes. This is why I'm not a particularly good person to revise with, because I take ages to revise. I'm not an efficient learner at all. I just find it so interesting, and I just love talking about these things. So I apologise. I think we'll keep it to about a 30-minute video. So we'll cover. Let's go on to the most inferior parts of the leg, going in towards the ankle. No fancy word for that. No fancy word for knee. No fancy word for hip. It's just the hip, knee, and ankle. The ankle, you have your two, what we call, your ankle bones, the things that you again hit on the sides of chairs and legs of tables. You have your medial malleolus, as you can expect, the medial aspect, and your lateral malleolus. And these together, you may think that's one bone, or maybe it comes down from a single bone, but they're actually anatomical structures of two different bones. The medial malleolus, I hope I get this right. I will be very embarrassed if I don't. I may even look it up as we chat. Sorry, there is someone kind of hammering something next door. I hope it's not too loud for you. No, I think the medial malleolus is a bony projection from the tibial bone, the tibia, which is the largest bone in the leg, and it's the weight-bearing bone, and the lateral malleolus comes from the fibular bone, a much thinner. It really does look like a pencil in comparison. You have a thick bone that's kind of reminiscent of the femur, but slightly smaller, and definitely a different shape in terms of its superior and inferior surfaces. But then you have a fibular bone, which is very small and can move it's much more flexible moving. Not flexible in terms of bending, but flexible in terms of the position that it's in when you move. And it's very much related to the twisting and turnings of your leg. And as a bone that isn't weight bearing, bones really only have many functions, such as making up blood and things, but the two sort of mechanical functions of your bones are to be weight bearing, such as these, but in the sense of the fibula, it's for muscle attachment, and that is it, and some structure, general structure, but that is about it. So I just wanted to quickly make sure I got that right, because I did see the bones down here. We have the coxal bone. That's what it's called. It's actually called the pelvic. I've forgotten it already. The pelvic girdle. There you go, the pelvic girdle. Is it called the coxal bone? I've not heard that before. So that's new to me. The coxal bone. How do I remember that? Oh, I really do like the coxal bone or the pelvic girdle. I absolutely love. It's one of my favourites. My favourite is without a doubt the femur. In terms of the lower limbs, I'm talking about. I love the femur. It's an interesting bone. Completely unique in its structure, and its structure is so perfectly made for its function. Obviously, all of these things are, but this one in particular. Here we go. We're getting towards the lower leg, or just the leg. Come on, I want to find if is it the fibula. I'm thinking it probably is. It makes sense spatially that the fibula would. See, now we're just getting into the nervous side of things. Maybe if we flick through a bit further, I think we'll find if the malleolus, which malleolus is on which leg bone, and we'll leave it there. See, these are some interesting terms, such as coronal section. Coronal, meaning a slice through, directly through the centre of the body. Kind of on a. I'll have to show you to truly explain it, but it's the angle. It's called coronal because coronal means crown. So you have a lot of different sutures within your skull, and one of them is the coronal suture, which runs directly from lateral side to lateral side, from side to side, directly across. And that's, if anything is cut through in that direction, that's called the coronal.